Hugh, what can you tell me about wamhinpc's most recent achievements?
There's many, and it's difficult to put them in any particular order, but I think the main achievement is to be recognised. Now you can go to a lot of meetings throughout Wales and talk about wamhinpc, and people don't say, who? What? Lots of people have now heard about us. And they've heard about it because they want to become involved, because it is very much, a grassroots involved organisation. But then if you want sort of specific things, we've got the conference we've got today, we have a practitioners network conference, we have the website, which has got a wealth of information on it. We are recognised as a source of information and advice for organisations like the Welsh Assembly Government, local health boards, and so forth. And we've had a great advance, I think, in terms of getting across our philosophy. It started with the Welsh Declaration. We then introduced gold standards and the hallmarks of person-centredness, trust, communication. And I think that's the changing attitudes that have been really, really important as far as we're concerned.
Mark?
And there's been a huge amount of work, particularly in the last 2 years, work streams which have been developed by members of the core group and other people. And so we're now producing regular information leaflets and other things which are coming out into the workplace to help support practitioners and people working at the coalface, so to speak.
I think people are now expecting these information leaflets, and quite rightly so, because they're coming out on a regular basis every other month. And indeed, we're getting so many that we're now having to think in terms of putting them directly onto the website without necessarily formally introducing them as the... What number have we got up to now? Number 6?
I think up to number 8, I think.
Number 8,
and we've got at least another 8 to 10 in the pipeline.
So if we did them every other month, it would take us 2 or 3 years before we caught up with the ones we've got, let alone future ones we want to do.
You've had a lot of support from the Welsh Government.
Very grateful to the Welsh Assembly Government for the money they've given us, but it's also support and backing. If you can say to other organisations, particularly say the local health boards, well, look, we are funded by the Welsh Assembly Government, then I think that adds credibility to us, without taking away from the street cred that we have with our fellow GPs and others in primary care who think, that they've got a grant, but they're not being told this is what you will do. We have a very fortunate position, I think. Don't you agree?
Yeah.
I think that was one of the things that was attractive to the Minister at the time, that we were a grassroots organisation and that we weren't speaking other than for grassroots people. And so I think that was one of the reasons why we got funding. I think one of the things that makes us, as you say, unique. There is no other organisation that has the same standing as we have.
I think the other thing that I think supported our application was the fact that we're not just representing GPs, though we're supported very heavily by the Royal College of GPs. The actual core group membership comes from a very, very diverse background, including counselling and psychotherapy, secondary care services, social care services. So, it's a very, very diverse group, which makes it really interesting and fascinating to work in. But I think also means that we can represent different sort of aspects of primary care mental health, because it's not just about what GPs do in surgeries.
Mark, you've taken on the role of chair of wamhinpc. How do you see things going forward?
Well, it's a great honour to take over after Hugh, and I wish to sort of at this point so thank you to Hugh, because he is, the network wouldn't be where it is now without his vision, his energy, his enthusiasm, his ability to take people with him, and that's a tall order, a big pair of shoes to step into. But I very much see my work as really evolutionary as opposed to revolutionary. I think we need to be stretching ourselves in 2 directions, really. I think we need to be stretching ourselves upwards in terms of policymakers and service providers, working with local health boards. But I think we also need to be stretching back the other way and making sure we're very well connected back at the grassroots level, and particularly in the world of primary care with GPs, that we get as many GPs as possible involved in the organisation, attending conferences, using the website, but also we need a continuity in terms of representation, again, at the core group level. Really it's a nurturing process from my point of view, but I think we just need to stretch ourselves in 2 directions without snapping in the middle.
So where do you go from here?
I think we've made a very good start. As he's already said, that our marketplace sort of position has changed dramatically over the last few years. We are now seen as a credible organisation, that people do come to us. But I think we need to keep working at particularly keep in contact with people at the Welsh Government level to make sure they're hearing about what's happening at primary care, because it's a hugely important area. It's a vast amount of our workload is taken up with dealing with mental health issues and mental well-being issues. And that's very, very challenging work. It's not easy work. It's something which some of our colleagues, I think, find very challenging and very stressful. And again, we need to be working very closely with our primary care colleagues to do everything possible to make them see that it is an important part of their work and to support them to do it as well as they possibly can. And that is very challenging, because I think there are a lot of people out there who do find it very difficult to do and would prefer not to be doing it. And I think that's the mind shift we need to work on, is getting people to accept they are doing it. They do it often very, very well, but with very little support, very little training, and we just want to try and fill that gap so they can do it even better.
It's a complex area for people in primary care, where the focus is usually on medical interventions.
It is highly complex, and it's not just about health issues. It's often involving things like social care issues, housing, education, training, a whole host of things which interplay into what defines someone's sense of mental well-being. And those are areas often we feel quite uncomfortable treading into, because we don't necessarily have the connections or the confidence to deal in those areas. And as doctors, I think, fundamentally we see ourselves as healers, that we do things, and sometimes it's very difficult when you're involved in this muddy situation where you feel there isn't a thing that you can do that's going to make someone better, and then we start feeling uncomfortable. And so it's actually supporting people to live within that environment and to recognise what they can do and what controls they do have, and perhaps to empower them to think perhaps outside the very medical box that we've been trained in and the way we've traditionally worked.
With the introduction of the measure, how can wamhinpc support the development of mental health provision in Wales?
Well, I think following on from things that Mark was saying now in terms of caring for people and support and so forth, I think the whole issue of this new mental health measure is paramount, really, because the part one of the measure deals very much with primary care. And I think this gives us a great opportunity to sort of supplement what you were saying about raising the profile of wamhinpc. I mean, we can act as the body that helps to explain what this is going to mean to primary care and people who are looked after in primary care. And I think that we are going to get support from the local health boards in being the organisation that puts this information across. We can support primary care in telling them about it, and then the first part of the measure will support primary care in terms of looking after people with mental health. And I think there will be an enormous opportunity for primary care to learn about mental health and how to cope and what to do and what the resources are locally and so forth from the introduction of that measure. So this is going to be a huge opportunity for primary care mental health to step forward and do really useful things with support. And so I think that's a big challenge for us in wamhinpc to make sure that we get the message across. Big challenge to the local health boards to give us the opportunity. A big challenge for primary care to sit up and take notice and use it.
I think there are other things. I mean, you've already alluded this morning in your introduction to the conference about dementia as being a huge challenge, I think, to primary care. You just need to look at some of the statistics and the demography of an ageing population and how many people we're going to have to be dealing with who are suffering from a dementing type illness in the future. And I think it's an area that, as GPs, again, we feel slightly uncomfortable with, because there isn't at the moment a cure. It's something that we can help and then we can manage to an extent, but I think it makes us quite uncomfortable about dealing with the diagnosis, sharing that with patients and the people who care for them, and supporting those people in whatever setting they end up in. But I think that is going to be an increasing challenge, and I think as GPs often we feel a bit uncomfortable. We feel stressed out by dealing with dementia, and I think that's an issue that wamhinpc is going to have to look at. And again, I think there's also a risk in the current economic climate. I think that I can foresee that there's going to be a rise in common mental health problems related to the stresses of living in a world which is financially challenged, and we're going to have to do that. We're going to have to hold the ring, really, when we won't necessarily have any more money, or there'll be some support in terms of the mental health measure, but I think that will be quite stressful for GPs dealing with the outcome, the fallout from restructuring of the economic climate.
And that ties in very much with the whole issue around work, because obviously with less work, how do people manage? But the need to return to work for those perhaps who had mental health problems, and the whole issues around work and the huge benefit of going to work, but sometimes the problems that lack of work produces, whether it's financial or just the whole thing of being out of work and not being in society as a whole. So I think that ties in very much with what you're saying with the economic problems, and I think, and then there's the challenges are there all the time for all sorts of other things, and think about the problems for the other end of the age scale. We were talking about dementia earlier, the need to think about children, adolescent mental health, the transition from their age group into the adult one, and how they sometimes slip between that. But there are just so many. We could go on, couldn't we?
How do you hope that the development of this material, for example, being available on the internet, will help people in providing mental health support in Wales and beyond?
I think from my point of view, I hope that this broadcast, whatever you call it, goes to more people than just those who are interested in mental health already. Because our problem is that we know there are people who are fired up, enthused, and really understand the issues. But there are those perhaps who know that there are the issues out there, but don't really understand that mental health is key. You cannot have good health without good mental health. And people don't understand that necessarily. And I think if they could understand, they think, oh, this is not for me, I don't understand it. Well, we are there for them as much as for the enthusiasts. We're not just a bunch of enthusiasts. We are there to support all people in primary care. And that's in its very broadest sense.